viewers, welcome to Data Plus. Today is a very important news update. You all everybody heard about that CDC and FDA recommend US pause use of Johnson's COVID vaccines over blood clot concerns. Everybody knows this. So we are going to see what happened in these vaccines. The CDC announced six women between the ages of 18 and 48 had developed cerebral venous sinus thrombosis (CVST), a clot in the area of the brain that collects and drains oxygen depleted blood. When this happens, blood cells may break and leak blood into the brain tissues, forming the hemorrhage. According to Johns Hopkins Medicines, the cases prompted the CDC and the US Food and Drug Administrations to recommend that administrations of the J&J COVID-19 vaccines be paused to allow for the further investigations. What does the pause mean? It really allows both the US Food and Drug Administrations and CDC to further investigate these cases to try and understand some of the mechanisms of what it is. Some more details about the history of individuals that were involved, said Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, during a White House briefing on Tuesday. In response, and Johnson & Johnson decided to pause vaccination in all of its clinical trials, while the company updates guidance for investigators and participants. According to the news release posted Tuesday afternoon, so the presenting symptoms. What are the symptoms? The six women developed symptoms of this rare and severe type of blood clot between 6 and 13 days after their J&J vaccination, the CDC said. Okay. For five of the six women, headache was the initial presenting feature. The vaccine safety lead with the US Centers for Disease Control and Prevention's COVID-19 response team during a meeting of the CDC Advisory Committee on Immunization Practices on Wednesday. The important thing to note there is the initial features are largely kind of non-specific symptoms, which at initial presentations or when a patient starts to become symptomatic may seem kind of mild and not that clinically significant. Things like headaches, lethargy, chills, myalgia, it is normal, common after vaccinations. Later, features include severe headache, some focal signs. In one case, severe abdominal pain, bruising, swelling in the lower extremities. One of the women died 12 days after receiving the vaccination. This is very significant. And entering the hospital with dry, having sudden worsening of headache and left sided weaknesses. According to a record in the US Department of Health and Human Services Vaccine Adverse Event Reporting System. Of the remaining patients, two are in intensive care, one is still hospitalized, and two have been discharged. Okay, so what does this mean if I've had the J&J vaccine? Everybody should know that. What does this mean if I've had the J&J vaccine? What should you do if you recently had the J&J vaccines? Okay, please viewers listen that. Don't skip these videos until end. Don't freak out. I'll be going on with my life. Okay, but I would be very attuned to my body. You say in your mindset. So, okay. If you develop shortness of breath, if you develop shortness of breath, if you develop leg pain, if you develop a headache, or if it is within 2 to 3 weeks of having had Johnson's vaccines, you would immediately notify to your healthcare provider. Okay. Don't panic. No need to panic. While distress may be mild at first, CVST produces unrelenting pain that does not ease. Okay, it gets worse. It's not pain that gets better by itself. Okay, while CVST is not a stroke, people can experience stroke like difficulty speaking or moving an arm or leg. Okay, these are symptoms. So if you have these symptoms, seek medical attention immediately. It is not the kind of thing that you wait until your physician office opens on Monday before you dealt with it. Okay, no need to wait. Seek immediate attention immediately. The cerebral venous sinus thrombosis affects about 5 people in 1 million each year. Okay, you have to know that. Cerebral venous sinus thrombosis affects about 5 people in 1 million each year, according to Johns Hopkins Medicines, occurring mostly in young adults and children. Okay, CVST has been known about for decades, and there are many conditions in which you could see CVST. Meningitis, which is the bacterial infection around brain, causes CVST. In infants, the cause of CVST is actually severe dehydration. Okay? It is yet unclear if the J&J vaccine was responsible for these 6 cases. Most of doctors said in the US. And the clots are extremely rare. So, COVID 19 is associated with the risk of blood clots that is thousands of times higher than blood clots possibly caused by any vaccine. It is important people not miss that. No one should shy away from being vaccinated with the Pfizer, BioNTech, and Moderna two-shot vaccines or the J&J vaccines when it is available. Get vaccinated. Don't panic. Okay. This is a update today update. If you like this video, please subscribe and share with your friends. If you have any comments, let me know in the comments box. Okay, see you. Bye, take care. We will see in another nice video in medical topics. Thank you very much for watching this.